we're a compassionate society.
No, we are not a compassionate society. In terms of our relationship to poor and working people, our record is worse than virtually any other country on earth.
I assume you're very well aware of the vehicle that is being used to repeal the Affordable Care Act. This is not some small piece of legislation. This is the Republican budget.
You guys want to end the expansion of Medicaid. That has people in Minnesota scared out of their mind.
A scene from last night's UFC fight, or just another Senate confirmation hearing? Well, this is how it goes. But this one for Health and Human Services nominee Tom Price, no matter who was doing the grilling, we still really didn't get a firm outline on what President-elect Trump and team are crafting to replace it. With us now, somebody who promises me he will do that, co-chair of the Republican Doctors Caucus, Tennessee Republican Congressman, the real Dr. Phil Rowe, here with us in a Fox Business exclusive. What is it? I was kind of hoping that everybody would get passed out a mimeograph sheet of here's at least an outline of what will replace Obamacare, because that's the big question, Dr. Rowe.
It is. Liz, 30 seconds. Here's the reason we can't pass it out right now. We passed a budget agreement last week, as everyone talked about. In that budget reconciliation package, the Senate parliamentarian determines what can be in that package. So we have to see what she will say is okay to be in it. Is it repeal the mandate fee, whatever that is. Number two, when Dr. Price, who's one of the most decent, honorable, competent people I've met, is confirmed as HHS secretary, then he, with the stroke of a pen, can do certain things like eliminate the 10 essential health benefits, which has run the cost of the ceiling. What's left after that, we have to legislate. And that part, Liz, will be harder because it will hit the 60-vote threshold in the Senate. And that might be across state lines, association of health plans, malpractice reform, transparency, high-risk pools, all of those things.
Listen, he did say repeatedly that the construct of what replaces it would be different. Well, a lot of people certainly hope so, because they didn't feel that the Obamacare plan was actually quite on point. But every time some people said, well, what about covering people with existing health problems, or what about the 26-year-olds who will then lose coverage? He said, well, the reason some of that wasn't in some of my previous plans is because I'm working with insurance companies. Dr. Phil Rowe, if y'all are depending on insurance companies to be open-hearted, leave it up to them, and they'll take the way out that they took in the 80s, which is denying a lot of coverage and denying a lot of yeses to, oh, this patient needs this.
You know, Liz, I did a very poor job in 2009, my first term, explaining the pre-existing condition problem. We all agree on that. We're going to cover pre-existing condition issues. Good. I saw it as a doctor. Two, allowing 26-year-olds, when the Affordable Care Act was passed, 26 states already allowed that. So that's something that's going to be in there, we feel fairly certain. So those two issues people are worried about are going to be there, whether it's with high-risk pools we covered, with expanding coverage lines, making the insurance pools bigger. That part will be covered. I feel fairly confident that will, very confident that will happen.
How much of it will be shouldered by the government as far as paying for it is concerned?
You know, for very poor people, obviously the Medicaid expansion, it's all covered. We went through this in Tennessee, this health care expansion 20 years ago. So what's happened to Obamacare, I've already seen this, it's going to fail. It's not a matter of fixing it. This plan cannot succeed. In our state this last year, our major insurer, Blue Cross, pulled out of Memphis, Nashville, and Chattanooga, the three largest markets in the state. Rates were up almost 60%. So it's going to fail under its own weight. Republicans are here to transform the health care system and make it more affordable and more patient-centric. In other words, I practiced, Liz, for 31 years. Doctors and patients, not insurance companies and government, should be making health care decisions, and that's where free markets come in. That's what we believe in. And what Bernie Sanders said, I heard on the lead-in, is absolutely wrong. Poor people are not treated better in Cuba than they are in the United States and other countries. He's absolutely spot on, dead wrong about that. Well,
in the end, people should find at least some comfort in the fact that Tom Price is a doctor. He has been there, he knows, and at some point, given the choice, you want a politician or a doctor covering this issue, it sure would be nice to have a doctor's perspective. And thanks to your perspective.